Welcome back to the final session in the Norfolk and Waveney Quality Improvement Training Series. My name is Michael, and in our final video, I will guide you through some suggestions for generating spreadable and sustainable change ideas. In this session, we will cover resources to help teams think about change ideas as part of the PDSA cycle. We will then cover things to consider when thinking about the spread and sustainability of change ideas. The first two tools we are going to talk about are affinity diagrams and driver diagrams. Both approaches can be used to identify causes and solutions for the quality issue itself, and therefore can be used multiple times throughout a quality improvement project. Both may help you to think about solutions that directly relate to the causes of your quality issue that you identified earlier in a previous video. As you can see, this example is exploring the potential causes behind why people do not attend appointments. However, you could turn each of these single items into its own solution for testing. Affinity diagrams are a visual tool to help you organize information and ideas from a stakeholder session. It is best used in a team, and this is where your stakeholders are really important. You start with people individually generating their own ideas to the top-level quality issue. The team then sorts ideas into different groups or categories based on their relationships to one another. A typical affinity diagram might have between 40 to 100 ideas. This tool can be done face-to-face using sticky notes, paper, or online using programs such as Miro. For moving on to the next step and deciding on which change ideas to prioritize following the affinity diagram, you can use a simple voting system within your stakeholder group or team. Everyone simply puts a dot next to the change idea that they think is the priority, and this might then be the first change that you make as part of your PDSA cycle. Before moving on, take a moment to think about your quality issue that you identified earlier. Usually, you would do an affinity diagram as part of a group, but can you think about how many different solutions you can think of to solve the issue? How many ideas can you think of in 1 minute? Once you've had a chance to jot these down, can you identify any common themes? Driver diagrams are a tool to create a visual summary of your project strategy and can help you think about change ideas. To begin with, you need a SMART aim using the method covered in the earlier video. Our SMART aim here is to improve 5-kilometer run time to 24 minutes by next December. You can then move on to the primary and secondary drivers, which are the areas you need to change in order to see improvement. These are similar to your themes or groupings that you may have identified in the previous slide using affinity diagrams. Primary drivers are the big topics or areas you need to work on to achieve your aim, with secondary drivers consisting of those which influence those primary drivers and may have less importance. Once you've thought about your primary and secondary drivers, you can then move on to your change ideas, which are the things you could do differently to achieve the aim. The importance here is about linking your solution to a driver of the quality issue. This is important for two reasons. First, it is more likely to be successful at addressing the quality issue if you've been through this process. And secondly, it helps with thinking about what can be measured to show whether your change has worked. As a general rule, quite often the people working on the ground who are aware of quality issues are the people who have the solutions to the problems. So it's crucial to get the whole team involved in both driver diagrams and affinity diagrams. Again, thinking about your quality issue, are you able to create a simple driver diagram on a piece of paper? Has it helped you think of new change ideas that you could test in PDSA cycles? So we've covered how you might generate change ideas using affinity and driver diagrams. However, before testing our change ideas, it is important to consider whether any changes we propose are 1, spreadable, and 2, sustainable. It is important that we can spread our successful improvements to ensure we can share best practice across other teams and other organisations. This also saves time for people who may be wanting to do similar quality improvement projects elsewhere. And to both spread and sustain any improvements, it is vital to engage people by explaining why the issue is important and continually articulate the positive impacts it may be having on patient care. Any ideas which help both staff and patients tend to spread the quickest. In the next few slides, we will go through 2 approaches to help you assess and think about change ideas using the EAST and COM-B frameworks. The EAST framework will help you think about the characteristics of a change that mean it is more likely to be taken into routine practice. And COM-B, which focuses on whether your change idea matches the team's capability, opportunity, and motivation to make and sustain that change. We will also talk about the NHS sustainability model. It is really important that you consider both of these elements at the design stage of your change, as you don't want to develop something that works with your team but falls down when you try to implement it with another. The EAST framework is a simple tool to use when generating change ideas to ensure they are sustainable and spreadable. It stands for easy, attractive, social, and timely. You want to make sure that any changes you're proposing are easy and that any change ideas are as straightforward as possible. They're attractive, so they use colour, images, or personalisation to grab attention to those improvements. They're social. They make the change ideas which can be reinforced through the power of networks and show that most people perform the desired behaviour to encourage others to do the same. And finally, timely. So you want to generate change ideas which can be implemented at a time when they are likely to be most receptive, as the same offer made at different times can have different levels of success. QI projects and change ideas which deliver benefits immediately or in the shorter term are more likely to be spread than those which are delivered later. The COM-B model for behaviour proposes that there are 3 components to any behaviour: someone's capability, opportunity, and motivation. And that when introducing change, individuals must be able to feel that they are both psychologically and physically able to do so, have the social and physical opportunity for the behaviour, and the want or need to carry out the behaviour more than other competing behaviours. So let's apply this to an example. Let's say a QI project aims to improve hand hygiene compliance. Using the COM-B, when thinking about capability, we might ask ourselves, are the staff adequately trained on proper hand washing techniques? Do they have the knowledge and skills to perform a hand hygiene correctly? When thinking about opportunity, we might ask ourselves, are there enough hand washing stations readily available? Is there sufficient time allocated for hand hygiene? And finally, when thinking about motivation, we might ask ourselves, Do staff understand the importance of hand hygiene? Do they feel motivated to prioritise hand hygiene over other tasks? As these components interact, interventions must target one or more of these in order to deliver and maintain effective behaviour change, which is important when undertaking, implementing, spreading and sustaining improvements. Think back to your improvement idea, your change idea. Do the people undertaking the new way of working possess one or more of the 3 behaviour change components? If not, it is likely any improvement change will not be sustainable or spreadable. If your answer is no, it is a good time to go back to your project team and ask for support from those with influence. The NHS sustainability model is a diagnostic tool to help identify strengths and weaknesses in implementation plans and predict the likelihood of sustainability for improvement initiatives and change ideas. It can be used from the outset and throughout the span of your improvement project. Another resource which might be helpful for quantifying sustainability in quality improvement projects includes this sustainability model. The model is split into 3 areas: process, staff, and organisation. The sustainability tool consists of a survey-style questionnaire in the 3 areas, in which points are attributed to each answer. This tool can create a completed portal diagram which plots your scores to see the potential areas for improvement in order to maximise the potential for the sustainability of your change idea. In the example shown, the green line shows the maximum scores based on what research has shown are the most important variables for sustainability. The purple line shows the actual scores, which indicates there are areas which require improvement around the category of staff, whereby the actual score is much smaller than the maximum score. This highlights an area which needs to have mitigations put in place to avoid any risk. In the next few slides, we will share some top tips for spreading and sustaining your quality improvement project. So to summarise, here are some top tips for spreading quality improvements. Start with a small pilot. Remember, quality improvement works best with small, systematic changes, not large transformative projects. Do not expect one person to do it all. Remember, you need to work with your project team and get your stakeholders on board, as discussed in our previous videos. Don't expect a working pilot to spread unchanged. Any improvements or changes may need to be tweaked when spread to other settings or contexts. Don't expect to look at the outcome measures on a quarterly basis. Improvement work requires monitoring of the data frequently to ensure you are on the right track. And finally, don't expect the person or team responsible for the quality improvement project to be responsible for system-wide spread. This is where you need support and backup from your system leaders who will be able to drive this forward. And in terms of sustaining changes in practice, some tips include standardization, so establishing specific practices and ways of working. Documentation, detailing clearly how new procedures and practices will work. This might be through updating of SOPs, policies, or staff training. Measurement, having a way of knowing over time whether performance is maintained. The use of run and SPC charts can help us to assess whether your quality improvement project has made a sustainable change And by using statistical tools, we can identify early if we are losing momentum in our improvement efforts, allowing us to remedy them. Education. So think about how and where you will educate the staff on how to use and implement the new change. Managing resources. So will any new equipment or training will need to be purchased to make the change business as usual? And finally, addressing the social dimension of change. So think about the human factors and psychology associated with change. The COM-B and EAST frameworks covered in this video can help with this. It is a good idea to be aware of people who might fall under early adopters, that is, those who can support and champion your project, and those who fall under laggards who are slower to adopt change, but who may be helpful in highlighting risks and issues to be addressed in the design and delivery of the project. Everyone has a role to play. Different engagement strategies will need to be developed and implemented for these groups and for the ones in between. So our session 5 recap. We've covered affinity and driver diagrams and that they can help you to generate and theme change ideas. And we've also covered spread and sustainability and that they are important factors to consider when generating those change ideas. Some final things to consider. How are you connecting with people to remind them why the work is needed? And how will you help people to feel that they are part of the change and have an important role to play in developing the change ideas? So finally, a recap to the Norfolk and Waveney Quality Improvement Training Series over the last 5 videos. There are lots of different ways of approaching quality improvement. You can use any tools and methods and any mixture of tools and methods, as long as any improvement work is undertaken in a considered, consistent and systematic manner. Use your project team to support. Quality improvement is never the responsibility of just one person. And lean into your stakeholder group. Embrace failure. It allows us to learn and come up with new, innovative ideas that can be tested. Quality improvement can be led by anyone, regardless of your job title or role. And finally, give it a go. You do not need permission to think, plan, and suggest improvements within your role or organization. Improvement is everyone's business. So thank you for watching the Norfolk and Waveney Quality Improvement Training Series. In this video series, we have covered the planning and testing stages of your quality improvement project. Ensuring that you have planned adequately will enable the rest of your QI project to run more smoothly and more quickly, and result in improvements within the organization you work in. Please feel free to revisit these training videos at any time. And our email address is at the bottom if you wish to pass on your successes from your own QI projects. Finally, this training series has been co-developed with our system partners within Norfolk and Waveney, alongside the wealth of resources that exist across the NHS. We would like to thank local, regional and national partners who have made their resources free to access so they can be used across different organisations and systems. And we have highlighted these under the training videos on the Connect Now intranet site. Thank you for watching. As mentioned, underneath the video description, you will find a contact email address for any questions relating to quality improvement within Norfolk and Waveney.